Hello, I'm Cody Picar, and today we'll be talking about universal health care. What is universal health care? Well, universal health care, defined by the World Health Organization, is a person who needs medical care and health benefits covered by one's government. And what that really means is if you go to the hospital with a broken arm or something, you don't have to pay for it yourself, it's already paid for. So there are three different types of universal health care. Single payer health care, which is the government takes money from income tax and applies it to hospitals and stuff and pays for it itself. There is mandatory insurance where if you have a job and you get paid, the payroll gets taken out itself and pays for it. And then the next one is national health insurance, where one country has one insurance provider for everyone. And you might be wondering, what is the difference between not having universal health care and having it? And in the year of 2021, the US had a 76-year life expectancy, while the average country that had universal health care had an 82 life expectancy, which is a 6-year difference. While 6 years might not sound like a lot, it pays differently, because in the year of 2021, the average person that lived in the US spent $12,000 for healthcare, while the average person in the UK, for example, paid only $6,000. And in these graphs, you can see the US is going below, and that's due because of COVID. But you can see in the graph, it didn't affect the average country, it affected us badly. And then if you look at this, the green chart is how much we pay, and the blue is the average, and we pay almost double than the average country with universal health care. And then in this video, I'll be showing you a politician and people affected by the healthcare industry.
This country has now reached more than 1 million COVID deaths.
For all the money we spend on healthcare, many experts believe we were not prepared for this fight. I don't think anybody.
And you can see the news anchor said that we weren't prepared, even though we pay more than two countries combined, we still somehow fell short.
Most of the feeling is just anxiety, exhaustion, and just not knowing when this is going to end.
In the state of...
And you can see that even though universal health care can cover a person, doctors and nurses still have effects from it differently. In the US, stress levels were at an all-time high, and nurses were quitting, and doctors just didn't want to work the job.
In Mississippi, some 2,000 nurses have quit since the pandemic.
People can't take it, not because they don't want to do a good job. We've made it really hard for them with this influx to our healthcare system.
I'm no stranger to some of the pitfalls of our healthcare system in the United States.
In total, my bill was $35,000. It's devastating.
That person had to pay $35,000. If we had universal health care, that person would not have to pay anything, and it would be covered by either taxes or their job.
What's the point of having worked for the last 20 years? What was the point of going to school?
Studies indicate that about 25% of American people hesitate, delay going to the doctor or the hospital because they're afraid of the bill.
And in 1991, Senator Bernie Sanders of Vermont talked about how a single payer system could work, because a lot of people do not want to go to the doctor because the bill could put them below the poverty line, or they just can't handle it.
I think the solution clearly must be a movement toward a single payer, universal, comprehensive health care, similar to what exists in Canada.
Enabling the entire cost of medicine for people of all ages, all of it, doctors.
And in 1962, JFK was even campaigning for it, and we still haven't had it yet.
The choice of doctors, hospitals, from the time you're born to the time you die. included in a government program.
In his remarkable speech, Roosevelt described the economic rights that he believed every American was entitled to. The right of all.
And you can see that he talks about how even FDR, which is over 100 years ago, talked about how universal health care is a right for the person. And in my call to action, I believe that if we do single payer method for universal health care, we can achieve it because we pay almost $1.7 trillion into it, taken from the physical data website that tracks how much a person pays in income. And then you can see that there's a chart for that.